Welcome back, everybody. WAJR's Ask the Experts continues. I'm Tony Caridi in studio today with Dr. Matt Lively and Amy Lancaster. This episode is being brought to us by HealthWorks Rehab and Fitness. Amy's the clinical director at HealthWorks Westover location, and Matt, a very familiar face, mountaineer orthopedic specialist. He's primary care doc and a sports medicine doc there with Dr. Bill Post over in Sheet Lake, and we're talking about low back pain. We talked about kind of the really super basics as to why, and 80% is the number that at some point 80% of us are going to deal with some back pain in our lives. Now, the question becomes, how can we fix it? And for that, I would imagine, Matt, that we have got a zillion different answers and different ways to try to jump on things. When people present to you, oftentimes, what's the first thing you do when you see an evaluation, and what oftentimes is the treatment option?
So the back pain many times can be complex, obviously, the cause of it and the reasons. So sometimes the treatments are also complex, but there's some basic guidelines. And so the first thing is, of course, different types of medications we might try, be it pain medications over the counter or prescription type pain medications, and anti-inflammatories if the individual can take those based on their other medical problems. So we would look at medications, the easier things at home like ice, heat treatments, those type of things. And then you get into the more specific type of stuff such as exercise therapy, physical therapy. Then you can also, there's manual therapy or hands-on type of stuff, be it massage, chiropractic, osteopathic, some types of hands-on stuff. And then there's even potential for injections depending on what the cause of it is and what you're doing. So it's kind of many times a stepwise approach based on the severity at the time, the chronicity of it, what they've tried before, what they haven't tried, and you try to start basic and then build up based on how their response.
Yeah, when it comes to treatment from your side, Amy, is there, and as Matt just said, there's so many different directions. What can people expect when they do get to that point where, hey, physical therapy would benefit you? What is the normal approach?
So the normal approach is we're doing a detailed examination, and we're trying to figure out, we use treatment-based classification and our clinical practice guidelines, which essentially we're trying to group patients into what's going to be the most effective way to treat their symptoms. And for certain people, that's going to be more of a manual therapy, mobilization, manipulation. For certain patients, they fall into more needing a neuromuscular stabilization program. For certain patients, we look for what we consider to be directional preference. So if they improve their symptoms with maybe either bending forward flexion or bending backwards extension, we begin a program to basically start there and then move more into the stabilization of the spine at that point.
Earlier on, we used a word called debilitating, as in debilitating pain. And I want to talk about back spasms, because they are something that can put you on to the ground. And it can be something as simple as you bend over one day and everything's fine to tie your shoe, and all of a sudden your back goes into a spasm and you can't move. Matt, why do spasms happen in that lower back area? Muscular, skeletal, what's going on there when that, what's it saying?
With many times it's the body trying to protect itself in a way. I mean, a muscle will spasm so many times when it gets overloaded. Its protective mechanism is to splint itself. And so if there is some way that the body feels that it's being overloaded or it's being in danger of being injured, then it will protect itself by tightening itself up and splinting itself. And so you're right. Sometimes it can take something you've done every day of your life, bend over and tie your shoes, but one time something happens that the body stresses an overload or it gets injured, and bam, you will get a back spasm.
You mentioned medications. What's the efficacy of anti-inflammatories in a general sense? You get good results?
For the most part, you do. I mean, not necessarily for spasm necessarily, but as general for pain, yes. Now, the anti-inflammatory effects of those medicines, many times what people don't understand is that works better if there's a steady state level of the drug in your blood. And it takes sometimes for the anti-inflammatory effects to take effect, like over a week or two of taking the medication on a regular basis. And so if you're trying to get both the pain and anti-inflammatory effects, it's a little bit different using the drug than just getting the pain effects.
You make a really good point, because I think a lot of times when we have a pain, we go, well, I'm going to take ibuprofen, I'm going to take an anti-inflammatory, and we just assume, if I gobble about 3 or 4 of these right now, I'm going to be good to go. That's the biggest misnomer, isn't it? That you have to have that in your system for a long period of time in order for it to actually serve as an anti-inflammatory.
Right. I tell people in clinic all the time, it's like we tell people, take an antibiotic until it's all gone, not until you feel better. Because if you don't kill all the bacteria when they're just smoldering in there, they'll come back. Well, the inflammation's the same way. If you don't kick it when it's down and get rid of it, it'll smolder in there. And when you stop the medicine, the inflammation can flare back up.
The name of the company is HealthWorks Rehab and Fitness. Now let's jump into the fitness aspect of it. Matt mentioned earlier, 80% of people at some point in their lives are going to have back pain. If we took care of ourselves from a fitness standpoint, that number goes down significantly, right? Is that what you're seeing a lot of times, is that we just don't have the strength, and as a result of that, the pain comes?
Yes, I would definitely say that if we could be stronger, a little healthier, then our incidence and the prevalence of low back pain does go down.
Yeah. So now let's jump into that next level then. What can we do? Someone's out there right now listening, and they're going like, I'd love to be proactive and do preventative work to try to strengthen my back so I don't have to deal with it. I don't want to be one of the people that one day does it. What's the best starting exercises for us in that abdomen, in that core? Ultimately, it's the core, which is going to help the lower back.
That's one of those things where it's hard to give generalized exercises to people because everyone kind of has different things going on. And for some people, it's actually more of a flexibility issue.
Okay.
For some people, it's mobility. For some, it is that core stability. And that is nice for us to be able to kind of do the screening on these patients. But in general, honestly, one of the best things that they're finding is yoga for low back pain. And in addition to just your general core work, I really encourage people doing more full body exercises that are, more like a plank than just sitting and doing your sit-ups or your crunches. But there are some good options. But I'd say as a general plan, yoga is something that they're really starting to show some of the best effects with if you're not doing a formalized exercise program.
Mm-hmm. Matt, biomechanically, why does yoga help so much?
Some of it's the static strengthening positions that helps to strengthen the muscles. It's the flexibility. So I think it's a combination of both, that the strengthening and the flexibility stuff is a well-rounded type of exercise for the muscles.
Your area of specialty is from that osteo standpoint, right? How much can manipulation help? Walk us through that.
So manual therapies, there's various ways of doing that. There's many types of manual therapy. Most people, when they think of manipulation, think of the cracking type, snap type, but there's other types of manipulation, more muscle-oriented ones, contract, relax type stretching, myofascial releases, different types of muscle-oriented techniques. They can be very effective for certain problems, and it's not a panacea like anything else. If it was, that's the only thing we would treat back pain with. But for certain problems, such as spasm, for tightness in muscles and stuff like that, they can be very beneficial. The one thing that I've emphasized to people many times, and we get back to the strength, like you mentioned, all the manual therapy in the world doesn't make a muscle stronger. You can get your back cracked or get a massage all day long, nothing gets strengthened. And if there's an underlying strength deficit that's leading to your problem, especially with chronic back pain, right, that doesn't get fixed with the manipulation. You still have to get some exercise in there.
Exactly. It's kind of like, I'm trying to think of an analogy here. The fire extinguisher will put out the car fire, but you're still going to have a smoldering problem as a result. You got to get it fixed.
Exactly.
You got to get it fixed. All right. We're heading into our third segment. We invite you to stay tuned. We're going to talk more about treatment of low back pain. You're listening to Dr. Matt Lively from Mountaineer Orthopedic Specialist and Amy Lancaster from HealthWorks Rehab and Fitness. And we'll have more coming up here on WAJR.